Hey everyone, welcome back to Corporate Decoder, the place where we unpack the secrets hidden in corporate filings. And today it looks like we've got a bit of a medicine cabinet mix-up that might have some ripple effects. We're diving into a filing from Allogene Therapeutics, a company focused on developing groundbreaking treatments, specifically a type of cell therapy for cancer. This report is a big deal because it details a significant change in their clinical trial strategy and a serious safety event. So what's the big news? Allogene has decided to switch up the treatment plan for their ALPHI3 study. This study is looking at a therapy called cemacabtagene ansigidleucel, or cema-cel, for a type of blood cancer called large B-cell lymphoma. They've chosen a standard combination treatment called fludarabine and cyclophosphamide, or FC, as the main lymphodepletion regimen. Lymphodepletion is basically a way to prepare the body for the new cancer-fighting cells by reducing the existing immune cells. This decision wasn't made lightly. It was a joint call with their Data and Safety Monitoring Board, which is a group that watches over the trial safety, and their steering committee, along with advice from the US Food and Drug Administration, or FDA. Now, here's where it gets serious. The part of the trial that was testing FC along with something called Allo647, which is a type of antibody, is being stopped for new patients. This happened sooner than planned because of a really severe adverse event, a grade 5 event, in a patient who received FC plus Allo647. A grade 5 event means it was fatal. This particular event involved liver failure on day 54 after receiving the treatment. The doctors believe it was caused by a widespread adenovirus infection in a patient whose immune system was weakened. Importantly, this event has been linked to Allo647 itself, not to the cema-cel therapy. While severe viral infections are rare in Allogene's trials overall, when they have happened, they've often been linked to the immune suppression caused partly by Allo647. What's interesting is that there haven't been any cases of adenoviral infections or liver failure in patients who just got the standard FC treatment in any of their studies. Because of this unfortunate event, Allogene is moving away from Allo647. Not only is it out of the ALC3 trial, but it won't be used in any of their other ongoing trials or future plans. This also means Allogene is shifting focus to their next generation of cell therapies, which use their special Dagger platform technology. The idea behind this new technology is to reduce or even get rid of the need for traditional lymphodepletion altogether. That could be a significant step forward if it works as planned. So how does the ELSA3 trial look now? It's continuing as a randomized study with two groups. One group will get cema-cel after the standard FC lymphodepletion, and the other group will just be observed, which is what's normally done as the standard treatment. The original design of the trial and how it's conducted are staying the same. The next big checkpoint for the trial will be a futility analysis. This is where they'll look at whether the treatment is likely to succeed based on something called minimal residual disease or MRD conversion. This is expected in the first half of 2026. Right now, over 50 medical sites across the US and Canada are involved, including major hospitals and cancer centers. Now, like many companies, Allogene includes a section on forward-looking statements. These are basically predictions about the future and involve risks and uncertainties. They're talking about their expectations for the ALPHI3 trial, why the adverse event might have happened, the potential benefits of cema-cel, and their plans for the Dagger platform technology. It's important to remember that these are just projections. Actual results could be very different due to various factors. The company is saying they don't plan to update these statements unless the law requires it. Looking at this filing from a bit of a distance, Allogene is clearly navigating the challenging waters of drug development. The safety event involving Allo647 is a serious setback and a clear signal that they need to be very cautious. The company's decision to move away from Allo647 and focus on their Dagger platform technology shows a strategic pivot. This new platform could be their ticket to creating safer and potentially more effective therapies by reducing reliance on harsh preconditioning treatments. The ELSA3 trial's pivot to comparing cema-cel with standard FC against observation is a standard but crucial step in proving efficacy. The future of cema-cel hinges on the results of this trial, especially the upcoming futility analysis in 2026. The shift in strategy also highlights a broader trend in cell therapy, reducing the toxicity of the preparation phase for patients. While this report doesn't contain detailed financial tables, the operational news is profound. The cost of such clinical trials is immense, and a significant safety issue can not only delay approvals, but also impact investor confidence and funding. The company's ability to manage the fallout from this event and successfully advance their Dagger platform technology will be key to their long-term success. The takeaway here is that drug development is a high-stakes gamble. Allogene has encountered a serious hurdle that necessitates a strategic change. Their future success depends on their ability to learn from this experience, innovate with their new technology, and ultimately demonstrate the safety and effectiveness of their therapies in rigorous clinical trials. Alright, that's our breakdown of Allogene Therapeutics' latest report. What are your thoughts on this development? Do you think their new Dagger platform technology is their saving grace, or is this a sign of deeper issues? Let us know in the comments below. If you found this deep dive valuable, please give this video a like and subscribe to Corporate Decoder for more in-depth analysis. And don't forget to join our Discord community for even more discussions and insights. It's linked in the description. Thanks for watching, and we'll see you in the next one.